I want to know a little bit about China, the number of injection drug users, and if you could talk about the HIV rate and what the context for methadone maintenance services is. Is everyone familiar with methadone maintenance? Yes? Yes? Okay. All right. So tell me a little bit about, what that looks like.
Okay.
And here, let me give you a microphone so that you can actually do that.
First, I'd like to thank the organizer for inviting me to be here, and I hope we'll have some wonderful time in this beautiful weather, okay? And so, for me, let me start. In fact, it can be started with a story. Around 23 years ago, there is one word most of the Chinese people don't know. There is one disease or condition very few people can have the information about. Maybe you already had the answer in your mind, right? The answer is HIV/AIDS. And my story starts two levels. First, I want to talk about China, or the nation. And then I want to talk about Ruili. It's one city in southwest of China, in Yunnan province. And that city is just along the border with Myanmar. And so its cross-border activities and are very active. And it's on the route of drug trafficking for those drugs. If the drug traffickers want to deliver them into China, then that is the big place to go through, okay? So first, let me talk about China, then I'll talk more about this case in Ruili. And I want to organize my talk by 5W and 2H. What are the 5 W's? Who, what, when, where, why, and 2H, how, and the second H, how much, right? How much it costs, the method. Yeah, and so for in China, the data for the HIV/AIDS cases are really very complete. And the first AIDS cases was reported as early as 1985. But in Ruili, it's significant in the history of the evolution of HIV/AIDS in China. Why? Because in 1989, over 170 HIV/AIDS positive were detected among intravenous drug users in Ruili. That's a big, big number in China. Because before that, sometimes the government just say, okay, this is a kind of disease foreigners have. But at that, it's just like a bomb, right? Oh, we found it here in Yunnan, in southwest of China, in Ruili, and among ID users. And for China, till 2010, the accumulated cases for AIDS is more than 34,000 for the whole country. And for the reported HIV/AIDS positive is more than 82,000 in China. And the development is not like this. It's not steadily increased. In fact, there are several stages. And between its detection in the mid of the 1980s till the 1995, it's just like underrepresented population. And then around after 2000, there is a kind of sharp increase. So when you look at that trend in the nation. It's just like, okay, just like the sea, it's so quiet, but suddenly you see a wave comes, then steep increase. And how about Ruili? The number in Ruili is like, because it's a small city, it's a city with the population around 170,000. But one thing specific about that city is we do have several minority groups, or sometimes we call ethnic groups there. And also another thing is migration. Among the total population of 170,000, 1/3 are floating populations. And the minority group accounted for around 55% of that total population in Ruili. And when we look at HIV/AIDS epidemic in Ruili, there are some numbers I want to share with you. At the early stage, in 1989, the cases for HIV/AIDS positive is only around 170. But till 2007, the HIV/AIDS positive is around 527. And for AIDS patients, the accumulated number is 233. And we also had 75 people died from HIV/AIDS. So that's for Ruili. And so really, when we look at China as a nation, then we say, oh, Ruili is a place first reported HIV/AIDS in groups of ID users, right? And another thing is its geological characteristic, and also migration, floating population, and different minority groups. And another thing for that is, for Ruili, it is one of the first cities which introduced the methadone maintenance programs. It started in 2006. Then by the end of 2007, we have around 511 MMT, I call MMT, so it stands for methadone maintenance treatment clinics in China. So in China, here I want to ask you whether the political system is the same in China and in the US. The answer is quite certain, right? No, it's quite different. How? How it's different? Take health care as an example. Is there any central agency here in the States control or manage the distribution of funding, resources, and also assigning the tasks and evaluate or this kind of coordinating role? Is there any in this country? No. In fact, the healthcare system in this country, sometimes we can use the word fragmented, right? We do have a lot of strategies, but by different stakeholders or organizations or State Department or federal government, but sometimes, or even by individuals, right? So, but sometimes there is no central agency who coordinate for all this. But in China, it's quite different. It's the central government has great power to coordinate health care in China as a nation. So when we look at the structure of delivering methadone maintenance treatment in China, the organizational structure is quite different. In China, we went in a kind of top-down system. The central government set up a kind of state MMT working group. And in this working group, it consists of Minister of Health, Minister of Public Security, State FDA, and also CDC, the National CDC. So in fact, it's interesting why when you hear these four departments, we find public security is involved in fighting against HIV/AIDS. Like police department is involved in this kind of war against HIV/AIDS. And also besides the national level, next we come to the provincial level. So we also have provincial working unit, especially in charge of methadone maintenance programs and the provincial level. It's also by these four sectors at the provincial level. And the provincial level is also in charge of the methadone formulation. And then next come to the city level or county level, then we have different clinics below that. And one thing good is once one policy is formulated, then go in this kind of top-down. It's quite efficient because it's quick. Yeah, everyone will follow that same policy. It's quick and it's efficient. But there is also something we need to improve in this system. Why? Because China is such a big country, right? There are a lot of different factors or different geographic or demographic or kind of or population characteristics or different trend of HIV/AIDS in different places. So the same policy to tackle with the same issue but under the different background can be sometimes a kind of a task very hard to achieve, right? But anyhow, in really, with the implementation of this MMT program, there are average, there are more than 200 drug users enrolled in this clinic. And they go to the clinic by bike or by motorcycles, which are the most popular transportation method to there. And the average travel time is around 15 minutes. But you see, one question, if even for a program here in Chicago, Illinois, if I live in suburban Chicago, I need to take the metro and then walk and to downtown to get the service, then sometimes it's still not so convenient for me to get the service, right? So, in fact, it's the same in Ruili. So we have two kinds of service. One is in the urban setting. We have the MMT clinic there. And also started in year 2007, we had mobile van to deliver service to reach those rural areas. Because we do have more people living in rural areas in Ruili compared in urban settings.
I just have a question, Mei.
Hey.
Was there any concern about the mobile methadone? I mean, mobile methadone is something that we would really like to see more of, I think, across the country in the United States. Was that an issue in China, having the mobile, the vans?
Mm-hmm. The mobile vans, and first it gives very efficient delivery of the service to more population, especially to those people who can't afford the travel to their place near home. But still there is some issues. Why? Because in Ruili it stopped in 2009. But that doesn't mean we give it up. And in fact, we set up 2 outreach sites. And we have more outreach workers based in that site to carry out, to move on with delivering the service. So, and first it's mobile vans delivering the service. But in that system, we have a kind of a record for all those people who receive the service, to keep record about that. But all those informations are kept confidential and will not be shared with others without the patient's concern.
I'm curious, do the outreach workers actually dispense methadone?
No, it's a kind of oral solution.
Oh, but they do give out methadone. The outreach
Yeah.
workers. I
Yeah.
mean, I'm
Yeah.
kind of going, whoa, really? Because I can't imagine, any place in the United States where someone would be doing outreach and giving out methadone.
It's
because it's so different than
Yeah.
the system here.
It's a kind of outreach site, so they have an office. They are not called clinic because they don't offer some other healthcare service such as immunization or seeing the patients or those things. So they only offer those health education and also delivering the oral solution.
Interesting.
And I see. So another question on my list is, what is the buy-in on the governmental level in terms of providing this service? I think because this, in fact, this is just as at the beginning we talked about the difference between the two countries. The government, in fact, it takes one active role in trying to push this. But at first, it did in a kind of cautious way. We do have some pilot projects in different places. We then to expand the project to more provinces. You see, in China, there are 5 provinces accounted around more than half of the HIV/AIDS numbers and deaths. Yunnan is one of them. And really in Yunnan accounted significantly high in that kind of epidemic. So, and when we look at, so I just now we talked about what is MMT, who, those patients in China, and so about who. Maybe you are also curious, who will need this kind of service? Of course, it's easy to think, okay, there are some drug users, yes, and how old are they? 20, 30, 40, 50, or 60? The average is around 33. Not too young or not too old. Because to use drugs, they need to, and first they need to buy drugs, right? And also, besides AIDS, for the ethnic group, we find around half are Thai people and Jimbo people, those are minority groups. And how about male or female? Make a guess.
Male.
Which one is more? Huh?
Male.
Here, this is the answer here, right? And there, over 90% who use the MMT service are male. And how about whether they do have a work or not? Around 70% of them are working. Yeah. But some of them maybe are farmers. It's a kind of seasonal work. And also, another issue in this kind of, we answered who, what, and when. Just now we said it started from 2006. And then how, I said it's delivered from top down, right? And another, how much? It's just for average usage, average dosage is around $1. The price is not so high. It's good for the clients, but it can be some kind of challenge for the providers because they need to spend a lot of funding in supporting this MMT program. Then, at the same time, maybe they need to cut down some health education or health promotion funding, something like that. And for the knowledge, how about the knowledge on HIV/AIDS for this group? In fact, they know HIV/AIDS quite fairly well. Over 30% had a fairly well knowledge level on HIV/AIDS. The average score is around 40 out of 19, or 14, I'm sorry, 14 out of 19. So, in fact, that's quite a good number. And how about when we look at healthcare, we have three things in our mind. We always want the best service in the lowest cost, in the most accessible way, and the best quality, right? And in the shortest time, right? And so for this kind of service, when we look at patients' willingness, what they want, so they, according to the interview, the patients expressed over 96 of them are willing to continue with methadone maintenance service for more than 1 year. And also, well, after the intervention, after taking the methadone maintenance treatment, there is some increase in the awareness and also in the knowledge level on HIV/AIDS. And more than 94% reported MMT is great, is helpful in reducing or stopping or the risk of HIV/AIDS. And still there is some challenges when we look at this program. The challenge comes from several aspects. For the patients, the challenge is there is always the temptation to reuse the drugs. And the drugs, because it's along the borderline and along the drug trafficking route. And so it's easy to get the drugs. So some people do fall back to use the drugs. Methadone is a kind of alternative, right? If you do have drugs there and it's affordable, then sometimes some people, there is some kind of dropout due to that. And another challenge is for the service providers, how we can provide better service and reach more people is still, just as it has been, it's still one main vision or one main task in our calendar. But anyhow, according to UNAIDS, our vision is zero infection and zero discrimination and zero AIDS-related deaths. That's our vision. So MMT is only one step in trying to reach this vision. And we still have a long way to go. And I think either China or the US, even though we do share different characteristics of the health systems or the providing or the clients' characteristics are different, but one thing is the same, the disease itself. And the same we are fighting against. I think we can really do something together to, as a resident who live or who reside on Earth, to fight against this issue together. Thank you.
Thank you. I just have one question. I have many questions, but I just want to ask a quick question. If someone does use drugs while they're on the methadone program, are they kicked out of the methadone program if they get caught?
They got caught.
If they get caught, do they not get, do they drug test them to see that they're not using drugs? Or can you still go get methadone even if you had a relapse?
I think they can still get methadone, but that's why we involve the public security in this picture, to provide them some workshops to let them know what's the difference between MMT and drugs, and so to give them some skills and knowledge in tackling with all those people around. Yeah.
But they wouldn't be cut off from services because they made a mistake. They would or would not?
Because drugs are illegal in China.
Right.
I don't know here. It's also illegal, right? So this is, we share some common points here, right? But in fact, it's a kind of sensitive issue. Sometimes, especially for NGOs, when they are tackling with this kind of issue, it's a bit hard to intervene because sometimes for some clients, they are afraid to use the service, right? They are just say, oh, maybe I will be on the blacklist. You see, you use that service, that seems you are a drug user, right? But these days in China, the atmosphere is quite open. And also, according to our interview in Ruili, most of the people get interviewed. We covered more than 90% of those who are involved in MMT program. And most of them they don't think discrimination or stigma is a big issue for them.
Really?
Yeah, I was a bit surprised to find that.
Yes.
Then we try to get down to say, oh, why? Yeah, this is, my assumption is a different picture. Why? It's different here. Maybe it's just associated with the fact that the high prevalence rate. And just as I said at the beginning, 23 years ago, maybe not a lot of people know this issue, but these days everyone knows it, yeah. And it's a small place. Then
That's very interesting. Thank you so much.